Hi friends and good evening to everybody. So today we have gathered here to have a brief discussion about orthognathic surgery or jaw surgery as we generally call it. And I have two of the most prominent figures in the field of orthognathic surgery with me. One of them is a surgical orthodontist, Dr. Harsh Mishra. So he is a consultant surgical orthodontist as well as faculty in Bharatiya Vidyapeeth Hospital, Mumbai. Along with him, we have an orthognathic surgeon who has been in this field for a good part of 15 years, has a lot of experience in terms of doing orthognathic surgeries and correcting various jaw deformities, Dr. Parit Ladani. So today we'll be having a brief discussion, a discussion where we'll be trying to answer a lot of questions that we generally get from patients. So we get a lot of inquiries about how we go about doing jaw surgeries, what are the common complications, what is the recovery time. And being a major surgery, people have their own inhibitions, people have a lot of questions that they have in their mind. So we are trying to make a series of orthognathic surgery where we try to answer some basic questions from the patient's perspective and see if it is helpful for a lot of you guys checking the video out and trying to make sense out of what we are going to talk about today. A lot of questions that we have today are a gray area basically in terms of orthodontics as well as jaw surgery. So there are few perspectives that we'll try to take from the orthodontist, try to read his mind and see if we can answer these questions as well as from the surgeon's perspective. So the first question I would like to ask the orthodontist, sir, so we get a lot of patients who have a lot of problems with the skeleton. Basically the problem is with the bone, there is a skeletal deformity and they are diagnosed generally with skeletal deformity. They visit the orthodontist first and the first thing that orthodontist tries to do is compensate that deformity dentally rather than actually seeing the skeleton. We do understand there are a lot of patients who have inhibitions in terms of undergoing jaw surgery. So my first question to you would be, can a jaw deformity, that is a skeletal jaw deformity, be corrected just by orthodontics?
First of all, very good evening, Dr. Jugal, and thank you for giving me opportunity to answer your question related to jaw deformity. So first we need to understand that jaw deformities can be classified in three types. First is mild cases, second is moderate cases, then third is severe jaw deformity cases. So when we come to mild cases, which are mainly dental irregularities, malalignment without any true deformity of the jaw or alveolar bone. So in such cases we can go ahead with normal orthodontic treatment and we can do miracle with orthodontics only without any surgery. But these cases are orthodontic cases only. These are not true orthognathic cases. Then second, moderate cases involves irregularities of the dentition and alveolar bone, which can also be corrected by orthodontics alone or sometimes with the advent of mini screws. Nowadays this is era of mini screws. So with use of mini screw we can correct the dentition as well as alveolar bone problem. So mainly these cases are class 1 cases and or some class 2 or class 3 camouflage mild to moderate cases. But whenever we encounter true jaw deformity, which is a severe or type C cases, always we have to consult maxillofacial surgeon or plastic surgeon for the treatment planning. Without consulting a maxillofacial surgeon or orthognathic surgeon or jaw surgeon, if we are proceeding with orthodontics alone, we are doing injustice to the patient as well as to the fellow professional, because we are not seeking their professional services if it is available, and we may not get the best outcome. So most oftenly dental and dentoalveolar cases, which are 50 to 60 or sometimes up to 70%, can be treated with orthodontics alone. But in severe jaw deformity cases involving class 2, class 3 severe malocclusion involving temporomandibular joint or any kind of facial asymmetry cases, syndromic cases, cleft cases. In such cases, orthodontics may not be sufficient. And if we are going ahead with orthodontics alone, or we are trying to camouflage the patient with our orthodontic therapy alone, it is gross injustice and to some extent it is negligence also. So it is always better to do a joint consultation with the maxillofacial surgeon for optimum treatment planning, because these cases are really challenging to treat.
Correct. So basic premise of what sir told was that mild cases can be corrected by orthodontics. A few of moderate cases are basically correctable with camouflage, that is hiding the deformity, not exactly correcting the deformity but hiding the deformity. And severe cases is an absolute indication for jaw surgery. So one quick question, one brief question before we go ahead with the surgical question is that if we are trying to work camouflage orthodontics in severe cases, does it make your job easier while doing orthodontics for subsequent surgical cases, or does it make your job difficult?
No, it is really very difficult to camouflage a surgical case into pure orthodontic case. And to be frank and honest, any orthodontist will not agree to this point. Whenever there is a need for surgery, there is need. Jaw deformities cannot be corrected with orthodontics alone in severe cases. So any orthodontist they should seek help from the fellow maxillofacial or jaw surgeon to treat the case and do joint consultation, evaluate patient from three-dimensional perspective rather than doing only camouflage. And patient may not be satisfied. There may be chances of failure, and patient may again retreat. They may seek retreatment. It will lead to financial burden, time wastage, and psychological problems to the patient, and it will lead to the failure on part of orthodontist also, as a not very a good orthodontist will never camouflage a surgical case.
So basic take home message for us from here is that if you have moderate to severe deformity of the jaw, you should always have a joint consultation as sir suggested with the orthodontist as well as jaw surgeon, and take both opinions and see where you go from there. Okay, thank you Dr. Harsh. So I will be moving on to Dr. Parit. So another pertinent question that we face a lot of times from the patients that visit us or call us or seek our consultation is whether is there an absolute indication of having to undergo orthodontics when we are undergoing jaw surgery. So patient we know is a severe case, requires jaw surgery, is willing to undergo jaw surgery, but a lot of times has some restrictions or in terms of the length of the orthodontic treatment, because we know that the patient has to undergo orthodontics once he's strapped up for a good 8 months, at least for 8 months to 1 year. So is there a possibility of correcting jaw deformity with only surgery without doing orthodontics?
Thank you, Dr. Jugal, for this question, because this is like a very common question patient ask. Can we treat our facial deformity without any kind of a braces? As you mentioned, braces treatment is definitely requires some timeline to treat this thing, but historically it's a deformity of face or jawbone. So it not only is a problem of the bones, it is also a problem with the teeth. Okay, so most of the time whenever there is a deformity, the teeth are trying to get compensated, like they are trying to get adjusted to each other in that abnormal position. So basically whenever we do jaw surgery, it is usually a combined approach, surgery along with the orthodontics. So except few very limited cases, usually it's not a good idea to avoid orthodontics and doing only surgery, because post surgery there is a change in their bite and the teeth may not be in a proper relation with each other, and in a long run same when we try to compensate and what consequences come here as well. When the bite is not stable, patient will have some problems like difficulty in chewing. They might have some TMJ problem. Their dental their teeth also will have a problem in a long run, like a periodontal issue and all these things. So in most of the cases, I would say more than 90% cases, it's usually a combined approach where we need orthodontics along with the surgery. But some exclusive cases where the teeth alignment is proper, where the bite is properly settled, like a case of where there is a obstructive sleep apnea, or a case where there is a facial asymmetry, but that their bite is very well settled, probably we can avoid orthodontics and we can do surgery by keeping the same bite. And for that we definitely need virtual surgical planning. We need to focus more on good planning, so that by keeping the same occlusion we can treat the facial deformity. But in general, do not try to take any shortcut. You need to understand that along with the surgery, orthodontics is also equally important. So most of the cases it's a combined approach.
Correct. So again, a short message if you have to take is like how surgeons are dependent on orthodontics. Orthodontics is dependent on surgery and vice versa. So what we have to basically remember is, for most of the cases, a joint consultation between an orthodontist and a surgeon is mandatory. So we have been talking a lot about historical approach, as sir mentioned, that we go ahead with conventional orthodontics. We try to reduce the compensations of the teeth. So most of the times what is happening is the teeth try to camouflage the basic deformity that is present. So what we have to do is we have to exaggerate that deformity first and then undergo surgery. So that has been the conventional treatment planning, which takes approximately 6 to 8 months initially for orthodontics, then surgery, and then another 6 to 8 months minimum for final orthodontic correction, which becomes a very lengthy period for the patient to undergo. So again, this question is to both the orthodontist as well as surgeons. How feasible is a surgery first approach? So what is surgery first approach? We try to do the surgery first and then try to do the entire part of orthodontics together. So my question will be, what are the benefits of surgery first approach and what are the indications of surgery first approach, and how can we choose the patient in a correct way for a surgery first approach? So first we'll take the opinion from the surgeon and then we'll go to the orthodontist.
Okay, so first I would like to comment what is surgery first. So as Dr. Jugal mentioned, in conventional approach, first we do pre-surgical orthodontics, which involves decompensation of the teeth. Because of the jaw deformity, teeth tries to get compensated, they try to go into the best bite, but they are not aligned as per the jaw bone. So when we do conventional approach, we first need to decompensate the teeth. So we have to align the teeth as per the jaw bones, not looking at the opposite teeth. That usually takes around 8 to 12 months time, and then we do jaw surgery, and that is followed by post-surgical orthodontics, which again takes around 6 to 12 months of time. In surgery first, after proper evaluation, after proper study and after proper planning, we initially do jaw surgery, and that is followed by the orthodontics. So the advantage is that we don't waste a lot of time in pre-surgical orthodontics. Second advantage is the jaw deformity is corrected immediately and the braces treatment can be continued post-surgery. Third advantage is there is a phenomenon which we call wrap, so that allows us to make the faster teeth movement, so the total timeline for the orthodontics also reduces. But definitely when we do surgery first, we need to do a good planning, so the plan can be executed properly, and with proper planning, probably many of the cases we can go with the surgery first. I think Dr. Hers can comment further on this.
Most of the things well explained by sir. So nowadays surgery first approach is gaining momentum, and most of the patient is asking for whether can we undergo for surgery first approach without orthodontics also. So in surgery first approach, the first and foremost advantage is psychological benefit. Immediate correction of the jaw deformity is visible, and patient feels very happy, and psychologically it gives immense positive motivation to the patient. But case selection is equally important. All cases cannot be done with the surgery first approach. Almost 30 to 40% cases we can proceed with the surgery first approach where there is a no severe crowding, but means in case of mild and moderate crowding we can go ahead with surgery first approach. Where there is a arch widening and there is no restriction in the patient's maxillary or mandibular arch. If arches are constricted, then we may need expansion with the orthodontic, or in surgical approach then we can go ahead with orthodontic surgery. Third is when patient is willing for surgery first approach. Sometimes patient's choice is equally important. So if patient is ready, we can proceed with the surgery first approach. Crowding, expansion, crossbite, and if severe decompensation is required with the orthodontic means, then also surgery first approach is slightly difficult path to take. So in such cases we can avoid surgery first approach. The rest all cases can be managed post surgery first orthodontics also. It is not that difficult. Nowadays more and more crowded cases or severe cases are also planned with the virtual surgical planning, so that we can predict the actual outcome post surgery. So if we are utilizing the softwares like MemoFab and we are doing virtual surgical planning where we can superimpose and we can simulate the treatment outcome, means these facilities are expanding our horizon for the surgery first approach. So surgery first approach requires both experienced maxillofacial surgeon also and orthodontist also. So for beginners it may be slightly difficult.
Right. So short message being that surgery first approach can be done if the arch alignment is fine and if there is no transverse discrepancy. And since we are talking about a lot of new things that are coming up in the field of orthodontic surgery, and how we have been talking about the new technology that is there, so the technology from a surgeon's perspective as well as from the orthodontics perspective, a very brief idea about what technological advances we have come up with in this time during the jaw surgery period, where there's a big boom in jaw surgery. One, for surgical perspective, is virtual surgical planning, and from the orthodontics perspective is aligners. So I would like to speak about virtual surgical planning first, from the surgeon's perspective, that is from Dr. Parit. What advantage does virtual surgical planning have in the overall treatment planning, in patient satisfaction, as well as the accuracy of the result that we achieve?
Yes, nowadays technology, as you said, has advanced well, and in orthodontic surgery definitely there is a big role of virtual surgical planning, because earlier we used to plan the surgery with the model, so it gives limited details and limited idea of what is going to happen during the surgery. But now with the use of virtual surgical planning, we can do planning in the computer, we can see all movements. Basically we can move both the jaw in all three dimensions to get a more accurate result, which may not be possible with the models only or with the 2D planning. And secondly, we are aware what kind of a movements and what kind of a challenges we are going to face during the surgery. Many times we can advance this planning into a PSI, which is like a patient specific implants. We can print a patient specific implant through VSP planning, which makes surgery more accurate. And of course, simulation is another advantage, so we can have some prediction that how patient's result will be post surgery, that we can see, and if any fine adjustment is required, we can try to do in virtual surgical planning. So basically it improves the accuracy during the surgery, so we have more accurate and more better result. We almost plan all cases in with the virtual surgical planning and do our surgery.
Right. So the manual planning is almost as good as obsolete nowadays. So moving to orthodontic perspective about technology, we will be talking about aligners and how that has improved the compliance of the patient in terms of undergoing orthodontics along with orthognathic surgery, even if they are staying far off and are not able to come very frequently for orthodontic visits. So your take on that?
So as we all are aware that patient travels from longer distance and remote towns to such practice. So here teledentistry or teleorthodontics plays an important role, and for which aligners are one of the most important area. So in aligners, what we can do, if suppose a patient is traveling from a longer distance or some other cities to our practice and they are interested in getting orthodontic treatment done here rather than getting orthodontic treatment done in their town because of faith or because of having confidence in somebody's work. So in such cases, what we can do, we can plan aligners for them, and as nowadays there is a direct printed aligners are available, then in-house aligners concepts are there, and which we are having at our center. So in-house aligners or any aligner planning we can do for that patient in one day only, and very next day we can deliver the aligner. In fact, one or two sets of aligner we can deliver the same day if we scan, virtually plan and fabricate the aligner. With the help of direct printed aligners, we can give few aligners same day, and meanwhile next 2-3 days we can deliver all the aligners to the patient. So patient can take that aligners to their place and they can wear with the weekly change or 10 days change, and once they are comfortable wearing, we can monitor through teleorthodontics or by video call, or some apps are also available. Invisalign practice app is there. We can use that apps to monitor that patients, and we can take regular follow-up. And for physical checkup, we can call them in between 3 to 4 months or 6 months if case is tracking. And suppose if case is not tracking, we can call them for physical checkup. So it eases the visit to the clinic. So financial burden is saved, traveling is saved, time is saved. They can concentrate on their work, their job or study, whatever profile patient is having. So in such cases, this teleorthodontics or teledentistry or aligners are useful tool, and it is also getting popularity day by day as these aligners are more comfortable, more happily accepted by the patient, and without very much inconvenience. Because after orthodontic appointment, when we tighten or when there's some ulceration, some pain, stress, headache is always there, and always traveling to the center is important. So with aligners we can remove all these hurdles, and we can give them good result without means discomfort, or with minimum discomfort we can give them outstanding results. Only thing with aligners is nowadays it is slightly expensive. I will not term too expensive, it is slightly expensive, but over the period of time it will also be affordable to our mass population.
Right. So we are basically trying to move towards more accurate, pain-free, comfortable,
customized
form of treatment for jaw deformities from both surgical as well as orthodontic perspective. So thank you both of you for having a wonderful conversation and giving such good insight to our patients as well as our viewers. So we'll be trying to get more of such videos where we discuss some of the very pertinent questions from the patients and as well as from the surgeon's perspective, and we'll be getting you more videos with different guests on panel. So thank you so much for watching.
Thank you.
Thank you very